Live. Let me pull up your comments, fam. It's Dr. Z. Today is a special day. Number one, we're going live on YouTube. Number two, it's Dr. Speak Up. That's right. Let's talk about that. Here is the video. I'm pulling up your comments. I'm going to give a special love to my fam, my, supporters on Facebook who help support the show by subscribing. All right, here we go. There it is. There it is. It's very Inception. Josette is here. She's the first supporter. Ashley Stewart is the second supporter. They get special badges and all that. It starts at like $4.99 a month, and it's really, really awesome way to support the show. Brittany's here. Sandra Bradfield's here. Erica Black is here. I love it. Okay, today, Jeffrey Lum is here. All my supporters are here. Man, they got badges. They get to use special emojis. All right, listen, but this is what this is about. We did a video about Dr. Nicole Baldwin, who's a pediatrician who made a TikTok video supporting vaccines. She was then attacked by a bunch of clueless anti-vaxxers. I call them the anti-vax cult because they are a cult. They're in an online echo chamber. They're a minority that just denies science, denies truth. Some of them have had experiences with their children that are terrible, and whether they're due to vaccines or something else, they're blaming vaccines. And so as a result, they've been radicalized. So like any terrorist, they go through a series of miseducation and they end up radicalized. And so what ends up happening is they attack Nicole Baldwin, just en masse, start writing terrible reviews on the physician review websites, attacking her Facebook page, writing terrible things about this wonderful advocate for little babies. And Erica Black used one of my special emojis, as does Brittany Heinrich, who are supporters of the show, subscribers. Okay, so they do all this, and the Shots Heard campaign, which was started by Dr. Todd Wolin, who's another pediatrician who's been on the show, we did a video with him recently, fights back, bans all these people from the pages, removes the bad comments, they go to Yelp, take off all the garbage, and it was successful. Now, the point then was we ought to all be speaking out like Nicole did. Doctors are notoriously cowardly around speaking out publicly about stuff because they're afraid it's going to affect their patients, their reviews. They don't have time. They're worried about, legal stuff. There's all kinds of reasons that doctors make excuses not to live up to their creed, which is the name doctor comes from the Latin root docere, which means to teach. We are teachers. So we ought to be teaching. Online is where people are. Go to where people are and teach them, and then stop complaining that patients are uneducated. Well, why? Because we're relying on celebrities, echo chambers on Facebook to educate patients. We can be doing it there. And when someone does it and gets attacked by anti-vax cult members, we can fight back. So I did a video, I love you too, Pika Paka Popo. We did a video where I said, look, hey, March 5th, pull the date out of my ass. Use the hashtag #DoctorSpeakUp, pull the hashtag out of my ass. And I picked doctors because we're the biggest cowards. Nurses have been speaking up, right? Hashtag healthcare speaks up's a little clunky, but you could use it. And I said, let's do something. Well, what happened? Really cool, passionate public health advocates took the hashtag and went crazy with it on Twitter. The Surgeon General tweeted it today using that hashtag. People have been sending videos, all kinds of stuff. And then the anti-vax cult said, oh, we'll co-opt it and use it to call doctors out on, killing babies. And all that did was drive more volume that made the hashtag trend on Twitter. Anti-vaxxers are the stupidest people. They really are idiotic. So the whole thing backfired on them. Doctors Speak Up is now national news. It was in Newsweek. It's going to be in other press soon. And this is just a massive thing. And why should it just be a day that healthcare professionals speak up about things they care about? It ought to be every single freaking day. It's what we do. It's what we're called to do, right? So that's what I wanted to talk about. Let's read some comments. Brittany Henrick, who's a supporter, says, lab nerds speak up. Hell yeah. Sandra Bradfield put hers on Facebook. Let's see. Jaskaya1 is using my emojis and says, yes. I love it, I love it, I love it. So the other thing I want to quickly pitch out, and Ashley Stewart says Dr. Speak Up was trending in Canada too. I mean, it is a real thing. This platform can actually do good things. We have a lot of influence. Let's use it for good. Let's fight the forces of evil. I like that, Erica Black. Parents Speak Up. That's a great one too. Here's the thing. So communities that represent autistic kids and parents of autistic kids on Twitter were tweeting thanks to the healthcare professionals who support them using hashtag #DoctorSpeakUp, because they know that vaccines don't cause autism, right? Let me read Callie's comment here. We care, likely why we've suffered moral injuries. Wonder if there'll ever be a class action suit for moral injury. And the question is, who do you sue? You have to sue a system that has sprung up over decades. I cannot wait for the guest that I'm trying to get right now. She's a healthcare historian, and she talks about how, starting with the AMA in the 1920s, our current system started to grow through no individual's fault. It's now a system that's so back-asswards and so broken that no one knows what the fuck to do. And so what they want to do instead is just cancel the whole thing and make it single payer. It doesn't work like that, okay? We can actually fix this with a third way, which is a grassroots, ground-up, clinician-led revolt. Whether it's direct primary care, whether it's telling anti-vaxxers to suck it, whether it's educating on social media, whether it's forming group cooperatives, changing regulations so that we can act as insurance companies for our patients like it used to be in the old days. Imagine that. Because then our skin's in the game to do the right thing for you, save money, but also make sure you're safe and sound. Man, I tell you, there's so much innovation that we could do that doesn't involve just cashing in our chips and being like, okay, let's let the government fuck it up. No, that's no better. The government's already 50% of healthcare. Big industry is already effectively like the government because they're so calcified and there's so much money at stake. It's a huge problem. Man, Callie, I will revolt along with you. I will be right there on the front lines, man. And we have to do this. Let's read some other comments here. I spend a large amount of time, says Jeff Lum, in vaccine threads to educate those on the fence and debunk their lies. And that's the thing. So this is another thing I want to tell people. If you use the hashtag #DoctorsSpeakUp and you see anti-vaxxers co-opting it, just block them, just ban them, deplatform them. Because the real anti-vaxxers, you can tell them, they parrot all the same shit. They have a pattern of behavior. They often use ad hominem insult attacks. You can just deplatform them because they are so radicalized that we are not going to change their minds. It's going to be something else. One of their kids gets polio, you know. We're not going to change their minds. But it's the people on the fence that have questions, and you can usually tell those comments. So I was concerned because I always feel like I get flu after flu shot. Or I heard bad things about HPV vaccine. What can you tell me? And we can educate them and go, that's all bullshit. Here's why. Here's why. Here's the data. Those are the people you focus on. And you not only ignore anti-vaxxers, you actively block them. Don't engage them, guys. Like, it's fun for a minute and it gets your juices all riled up. I used to do it too, but it is a no-win situation. And all it does is give them more juice. Now, I like to piss them off and have them come in the comments on my stuff because it juices the algorithm. We get more engagement, and YouTube and Facebook serve it up more when anti-vaxxers get pissed. So when you poke the anti-vaxxer nest, you can get your message out better. So I definitely manipulate that for the good of what our message is, right? Four Lost Comments says, the vociferously anti-vaccine are useful props because their ideas are so poorly informed and easily debunked, you can use them to show the ludicrousness of anti-vaxxers. That's a brilliant comment, and I've done that many times. So we did a whole video about anti-vax Janet, and the other one where, you know, she's debating me, and you just see the insanity of their kind of thinking, and it's like, oh, this is great because these people are dipshits, and you can just point out how incredibly delusional they are. It's like the flat earthers. Like, it's just the core of this is delusion. Let's be honest. Gisette Williams says, I'm so introverted, but I leave home just to get my vax and come home. Dude, I feel you, girl. I'm actually, weirdly, I'm an introvert. I'm an extroverted introvert. Let's see, Dragiza Radovinovich says, there was a Medscape article on a doctor that killed himself over regret over faking vaccine certifications. The anti-vaxxers were spamming the comments even on Medscape. It's disheartening. So yeah, I read about that doctor. He was an anti-vaxxer and he was telling people, he was doing fake exemptions, which a lot of doctors do that are just criminal. And we've talked about that with Richard Pan on the show because he introduced legislation to stop that in California. But also he was potentially not vaccinating people that he was saying he was vaccinating, I think. And so his suicide note intimated that he had a lot of regret over that. Anti-vaxxers will never pass up a chance to capitalize on a tragedy and make it awful. So if a child dies because of sudden infant death syndrome, the anti-vaxxers will swarm onto the platform where they're posting their GoFundMe or whatever it is and be like, yeah, you vaccines did this. I mean, it's fucking sick, you guys. These people are sick animals. Let me be clear for a minute. The delusional anti-vax cult, and I'm talking about like Robert F. Kennedy Jr., Del Bigtree, these guys lead this shit, Andrew Wakefield, these are their people. There are these pockets on the internet that do this, you know, Natural News and, you know, Aaron McNutt and Joseph Mercola and these guys. They're the leaders, Sherry Tenpenny, who's a criminal, basically. These guys, they're selling books, they're selling supplements, they're selling tanning beds. They are part of the supplement industrial complex. But they will be the first to accuse normal doctors of being pharma shills. These people are fucking criminals, period. They are harming children. They are, if they're not delusional, then they're hyper manipulative of people who are delusional. And the people who are hurt are those on the fence who are then the victims of the next measles outbreak. So the victims of them are people who are too young to be vaccinated, people who have immune compromise that can't be vaccinated with certain vaccines, live vaccines, people who are old where the vaccines don't work as well. These are the people who are hurt. Thank you for the $4.99, Sandra Bradfield. So I'm a pharma shill too. See, I'm selling out to Big U. I don't take any money from pharma for this shit, okay? I take money from you. I'm in your pocket. Fucking A, man, these people. Why doesn't anyone ask the anti-vax peeps if their parents had them vaccinated? Well, because they'll say yes. It's absurd, man. And then Nancy Burns says, and she's a supporter, since Corona, more people getting vaccinated. Yeah. So here's the thing. Let's talk about flu. I talked about this on Facebook just now. Let's talk about flu vaccine. So if I told you that there was a new coronavirus vaccine, which, by the way, the hysteria over coronavirus, it's only warranted to the extent that it helps healthcare providers prepare, because it will be severe for healthcare professionals, because you're exposed if you don't do the right thing. There's a run on all the masks and all that. But for the general public, shut the fuck up about coronavirus, okay? Wash your goddamn hands. Stop being a little bitch, because the press will have you insane. If you go on Twitter, you will lose your mind. I am telling you, stop panicking. Be rational and do the things that prevent infection. But more importantly, now healthcare professionals is a different message, because Peter Hotez and I got on this very channel and talked about what healthcare professionals need to know. They're at particular risk, right? So we need to be prepared for that shit. And that means that the public can't use all our goddamn masks. Doesn't help you in public to wear a fucking mask unless you're sick. Unless you're sick and you're trying to prevent the public from being sick. Walking around with a mask just makes you a fucking dick. And you look like an asshole. So don't do it. So that being said, coronavirus, if I told you, God, I get fired up this time of day. If I told you that coronavirus had a vaccine that was 40 to 50% effective, would you get that vaccine? And the answer is, with all the hysteria going around, absolutely. If you were a healthcare professional, 1,000% you would get that vaccine. And if I told you the vaccine was safe and effective and really had minimal, the side effects were a sore arm, some muscle aches, maybe a low-grade fever transiently, and in very, very rare, like 1 in a million, something like Guillain-Barré, where you're hospitalized with an ascending paralysis, which we don't even know is caused by flu vaccine, because flu itself can cause Guillain-Barré syndrome. See my video on that? If I told you that, what would you do? You'd get the fucking vaccine. Now, what if I told you influenza, millions every year, it's less fatal than coronavirus, but it kills people, old, young, and well, and sick every single year, and that we have a vaccine that this year was 40 to 50% effective, would you get the vaccine? Fuck yeah, you should, but you don't. But you don't. That's just dumb, okay? It's just wrong-headed statistics. There's runs on toilet paper. Samantha's pointing out at Walmart. Thanks for using the emoji, Jessica one. Absolutely. God, now, oh God, dude. So it's funny. So I have a call with YouTube tomorrow about talking about how we can better communicate COVID-19 stuff. Because it's hysteria, you guys. Like, we need to, it's a pandemic now. It's clear, it's all over. It's probably been all over for a while. We need to listen to experts and do the right thing and prepare, especially on the healthcare side, but not go around buying all this shit from Costco. Oh my God, you know what I've been doing? I've been going to downtown San Mateo and hanging out because it's empty. Like, all my favorite coffee places, or just get anything I want from the grocery stores without waiting in line. It's the best because people are dumb. Samantha PV vaccine came out after Brittany Heinrich, when North Carolina got their first case, fuck. I mean, I've got a couple from the music video we did. Them for the music video. By the way, that My Corona, now officially viral, no pun intended, and it was played on German TV. I got messages from friends in Germany who were like, I just saw you on TV in Germany, in Deutschland, and I'm not gonna take advantage of this thing. And I'm like, fuck, I already did it. And it was in the article. They're like, a guy named Dr. Zubin Demanya on YouTube, a YouTuber, did this video, and they linked to the video. I was like, oh shit! It's really awesome. Because that video, we put educational points in it. We were trying to diffuse hysteria. What you fucking do. Doctor, speak up. We were speaking the fuck up. Could Weird Al do that and get away with it? Probably, because he's Weird Al, but he's not gonna have the same credibility as a motherfucking doctor. Sometimes I get really excited about the shit we do, guys. Like, I get fucking fired up. Because there's nobody, okay, look at this Venn diagram, motherfuckers. You're part of a movement, all right, where you have a dude who is pretty insecure about his shit because he's this guy. But if I'm gonna be honest, I'll go, well, here's what we have going for us if we're gonna influence the conversation on healthcare in this country and the world. You got a substantial doctor from a good academic institution, busted his ass for years, for 10 years in the trenches. All right, there's that Venn diagram. And you've got a platform with a bunch of people who are willing to spread the shit. There's that. Then you've got willing to say shit that no one else will say because he can't lose his job because he doesn't have a job. That Venn diagram. And then, well, he kind of makes music videos. That's another way to teach and entertain and does comedy. There's that Venn diagram. Who stands at the fucking intersection of all those Venn diagrams? Sometimes when I feel down about, man, we're not influencing change enough, I think, okay, we're actually the only people who can do some of this stuff. And you look at the My Corona song, you look at Dr. Speak Up, you look at this, we are using, with you together, ZPAC, this platform for good, period. And if you support this show, that's great. By the way, we're gonna sign up on Fundo, which is a new platform that Google launched with YouTube that allows us to sell tickets, raise money for the show, but for small groups to have virtual chats with me by video. So we group up, you see the images at the bottom, and then I pick one person at a time and we talk. What a great way to share ideas, to actually influence change, to have good access to new thoughts and connection and engagement. So if you subscribe, probably get that for free. Otherwise, we'll sell tickets for like 15 bucks or something, and we'll make the date and put a link, and you can sign up if you're a subscriber. If you're not a subscriber, I may not do that, or I may charge more money. Because I think I want to reward my supporters and subscribers with better access. And you guys are the super fans. You're the ones who care, because that's the fifth Venn diagram, is the fans are healthcare professionals. They're healthcare professionals, mostly, and activist patients, people who care, that work in healthcare, can make the change. It's a grassroots thing, motherfuckers. Let's see what we got. Ninja Unicorn, who is a supporter, seeing all those people in China wearing masks, but it makes you feel better. It helps your psychology. There was a great piece in Psychology Today about the moral panic around epidemics. This is a classic example of a moral panic. People freak out and they get a disgust response, and there's like xenophobia and all this other stuff. In reality, the chances of you getting fucking this disease are pretty low, and the chances of you dying from it are even lower. And yet, we have things, we take them very... So that's the other thing. People are rubbing their eyes around their mask. People are coughing in your face. If you don't have eye protection, droplets go in your eyes. The motherfucking hands. That's what you gotta do. Just wash your damn hands. Helps a lot, goes a long way. Especially healthcare professionals who are shitty at washing hands, you know? Because if you do the studies, it's like, then JCO goes away and it's back to like, well, I'm just gonna, maybe I'll gel, I don't know, or not. Doesn't kill the C. diff spores, but fuck it. Oh my God. I have a question, says Brittany, who's a supporter. I'm on Humira and I'm wondering if I am at higher risk. I don't know the answer to that, because look at data and go, okay, who in the population who's been infected has been immune compromised due to a biologic like Humira, because you are at higher risk for things like tuberculosis, I believe lymphoma, because of the immune system modulating effects of Humira. So here's a question. Is COVID-19 coronavirus deadly because of poor immune response, or is it deadly because of an overwhelming immune response that causes ARDS, fluid to fill in the lungs, a cytokine storm, and things like that? I think the latter seems more likely, but again, we just don't know. I would say you were treated as immunocompromised. And, you know, as modulating the immune response that is fatal. The virus itself may not be the direct one. You drown in your own secretions, everything. Covering those TNF cells, exactly, novel idea. Let me read here some comments. Sarah Crane, I want to be a supporter right now. Videos subscribing on YouTube, being a subscriber, not necessarily. The joke was hilarious, but honestly, bovines have been getting the coronavirus treatment for over 20 years, and I don't know if it's just a different strain we're dealing with. So there are many coronavirus cause the common cold. SARS was a coronavirus. MERS was a coronavirus. This is I think MERS was a coronavirus. I have to double check that. Don't quote me on that. But it's just a family of viruses, of which COVID-19 is one. Coronavirus, discovered in 2019, severe disease, that's one version. MERS was related, Ray Williamson says. So there you have it. I believe Ray Williamson, perfect stranger on YouTube. That's my source, Ray et al. I like it, thanks Ray. Sarah Crane, I've been a sub for quite a while. Love you, Z-Dog, and I love you too, Sarah Crane. I recognize your name on many of these live casts, so thanks for being a part of this. Let's see. It was related, Brandolin. I'm a paramedic. There you go, Ray. That counts. Fucking, that's awesome. So now you're a legit specialist in this. I have to leave the house to get my infusions at a local cancer center. I'm wearing mask and gloves. Pity's mom 10. That's fine, Gina. You are immunocompromised going to a cancer center with other immunocompromised patients. Come on. It's a no-brainer. MERS is a coronavirus. That's right, 4 lost comments. So now we have a quorum on that. It's a beta coronavirus like SARS-CoV-2. You know what I love about YouTube? There are some smart motherfuckers on here. Are they considering convalescent plasma or immunoglobulins for COVID-19? I don't know the answer to that, Callie. Someone weigh in on that. I can ask Peter Hotez about that next time I have him on the show, because that's a great question. 1 like equals 1 cured of corona, guy that comments. That's fucking amazing. Bushcraft Master, can the coronavirus enter via the eyes? The answer is yes. So any mucous membranes it's felt can be a portal for entry. Sarah Chuck, welcome to the SuperPac. You joined as a subscribing supporter. Thanks for your support and welcome to an amazing tribe. I'm old, had all that childhood illnesses. Is my immune system stronger? Christopher Wookie. So it seems that older people are having a bigger problem with this. Maybe it is because they have an aggressive immune response historically to coronavirus, or maybe it's because their immune system is weaker as we age. So it's unclear. It's absolutely unclear what is putting people at risk. Nobody knows, and that's a problem. I asked Peter Hotez on this show, and he says, I wish I knew the answer to that. We don't know. Let's see where we at. What happens when I click this button? Oh, it just says who signed up new. Sarah Chalk is our new sign up for the SuperPac. How does this virus impact those who are HIV positive, Z-Dog? Shazzy 1228. What a great question. We don't know. I don't know the answer to that yet, because you have to have enough people who are infected who are HIV positive and do a study of that and see what it would do, because you have different differential immune response in HIV positive patients depending on their CD4, also depending on the other drugs they're taking for their HIV disease. So it becomes a complex thing. I'll get my brother-in-law, who's an infectious disease doc, on the show to talk about that. Let's see. Oh, Sabrina Stearns has joined the SuperPac. Welcome as a new member, Sabrina. I love to see that green light up. It means that we're growing our tribe, and it means that we can support all this fucking equipment. We just are closing on a property in San Carlos that hopefully will allow us to build a studio there. That's the goal. We're taking some of the supporter funding and we're going to pay the mortgage on that place. So stay tuned. We'll get out of this goddamn garage. China did 2 lung transplants on COVID-19 patients. What the fuck? Mary Miller. I hadn't heard that, but the truth is when you have severe scarring, lung transplant is the only thing you can do at that point. You know, it can be very, very bad. What if you have arthritis and are taking Enbrel? I don't know the answer, Marissa K. Loving mom for kids. I heard from healthcare worker they're using HIV meds and they seem to help some. So there's one HIV med that they're studying that may be helpful as an antiviral. So stay tuned. We don't fully know the answer, but it's being looked at. And I believe the manufacturer is here in the Bay Area. It's very interesting that this virus has not affected children, the owl. There have been no documented deaths that I have seen yet in children under 9 from this virus. So what does that tell you? We don't know yet. It could be maybe there's an immune potentiation from previous coronavirus exposure in adults. Maybe it's just a differential immune system. Maybe you're more robust as a child. We don't know. It's really interesting. And it also tells you that maybe the kids are having, it's entirely possible that the kids are having asymptomatic disease or minimally, sniffly nose, that kind of thing, and they're not telling you, and they're spreading it, right? They're vectors and you just don't even know it to older people. 4 lost comments. Radiologically, this thing is known for the fact that it tends to cause bilateral pneumonia versus unilateral, which is more common for influenza. Exactly, 4 lost comments. It's a diffuse bilateral pneumonia. My wife, who's a chest radiologist, has been very carefully looking for it at Stanford. Because they will just call the emergency department and say, you didn't ask us about this, but we're seeing bilateral pneumonia in a person that doesn't have a lot of risk factors for that. Have you thought about SARS-CoV-2? And so everybody's kind of alert for this based on what their specialty is. I think the fact that children are doing so well suggests that humoral immunity for the virus is especially important. For Los comments. Yeah, and the question is does non-humoral immunity make things worse in terms of immune response, or is it the humoral immunity? So it's very interesting, very fascinating stuff. So, guys, should we keep talking about this? What do you guys think? Looks like we got a good discussion going. Stephanie Dyer, one of those problems that we have right now is the same as when HIV started. People thought that only gay men could get HIV. The initial panic gave way to a window of exhale. Then we found out the truth. And this is interesting. Remember they used to call it gay-related immune disease, GRID, because that's what people thought it was about. And people were like, well, whatever, which is terrible. And no, it's like, remember, the whistleblower, Dr. Li Weiling, he was 33 and died of this. And again, the question is, did he get a big inoculum of this virus in the hospital? Has the virus changed? What's going on? Are we starting to see mutation patterns in the virus where it's going to become more or less virulent, more or less transmissible as well? We don't know. Dan Harris, yeah, they say CT is good and accurate means for diagnosis, confirming with lab tests, of course. Okay, so Dan, let's unpack what you just said. This is important. And I was talking to my wife about this. CT is excellent for detecting this because you see these not unique, but you see these sort of pretty typical patterns that then they can say, okay, that's something even before the tests come back. You have somebody with bilateral pneumonia, the bacterial stuff's negative, so on and so forth. The problem with using CT as a screen is that, at least at Stanford, what I heard was the disinfectant protocols for CT scanners, after you pull a patient out of there and you have to disinfect, that can take up to 45 minutes. And so you are clogging up that CT scanner doing screening, exposing people to radiation, all the other stuff, when it's going to slow down the entire workflow for CT. So these are the logistic issues with that. Plus there's cost and all that, but of course there's cost with this no matter what. Rhonda Lee Estanislao, welcome to the SuperPac. You are a new subscribing supporter of this show and I appreciate you. And Andrew Dunbar sent $10 as a super chat. He says, In the event of a public health emergency, the Selective Service System has the authority to draft medical professionals up to the age of 40. They can even draft specific specialties, so that's fun. Is that true, Andrew? I've never heard that. You can have a medical draft? Wow. That's simultaneously terrifying and comforting. I guess you could get people to like help out, but boy, I don't want to be drafted. Of course, I'm 46, so they can suck a dick, but still, that's crazy, Andrew. Someone confirm that for me, what Andrew's saying. Stefan Hayes says the Chinese government killed him, the whistleblower. So Stefan, I'm not sure about that. He was on ECMO. Initially, I thought the same thing, but now I'm starting to think it would have been really bad PR for them for that to happen, because they made a martyr out of him. And I don't think the Chinese government's that stupid. They're very good at manipulating. So I don't think they killed him, actually. I really don't. But what the hell do I know? I'm not there. Samantha sent $5 and says, keep it up. Thank you, Samantha. And Cynthia sent $1.99 for the new studio. Hell yeah, Cynthia! Thank you. I hope you guys are excited about this Fundo thing. I'm gonna put out links soon once I sign up. I had a call with Google today to get onboarded, and they're only doing this with like 100 creators. So we're part of a beta test. It's gonna be fun. Virtual private chat with me, sell tickets in advance, very exclusive, so you don't have dipshits showing up. It's gonna be great. How long do you think it will be before Big Pharma and the PBNs take advantage of this virus? I feel it coming, Z-Dog. Shazzy1228. Oh, they're probably trying already. Did you guys hear, by the way, that the HIMSS conference was canceled? HIMSS is the biggest health IT conference where all the douchebags and across the industry show up and jack each other off in Orlando or Las Vegas this year. I think it was in Orlando. It's a massive, I've been there a couple times because I've had to speak. It is the worst. It is the worst. Boring talks, industry douchebags masturbating each other. It's fucking terrible. And it was canceled due to coronavirus at the last minute. And I was like, ding dong, the witch is dead. Now, again, there are a lot of good people there trying to do good things in technology, so I shouldn't be such a dick. But I'll tell you, as a user of that conference, I found it awful. It's just too much. It's just way too much. And it's, you know, Epic has a booth that's like $100,000, and it's this huge fucking thing. And all I can see when I walk around, I took video of it last time, all I can see is our healthcare dollars being squandered, right? Why the hell do we need big conferences like that? What we ought to be doing is fucking lean and mean, adaptable, customizable software that serves the physicians and their patients and the nurses and their patients and the healthcare professionals and their patients, and gathers data in a private way that helps understand the science better. That's what we fucking need. We don't need a big ass conference to jack each other off and sell each other widgets. That's because that's what that shit is. So coronavirus had one good effect. It canceled HIMSS. Let's see. Stephanie Dyer with $9.99. Thanks for being a #1 fan, girl. Where are we at here? A Diddy, Andy, people indoor rock climbing with a VR headset while charting in Epic on a laptop. Exactly. That's the fucking. Jimmy Lou, starting school this fall and love watching your videos. Keep it up, Z-Dog. Hey, dude, good luck on your path, Jimmy. Zeitgeist X. That's a great name, by the way, because it's got a Z and an X in it. X gonna give it to you, gonna give it to you. So Zeitgeist X says, Healthcare Personnel Delivery System, HCPDS, is a standby plan developed for the Selective Service System at the request of Congress. If needed, it would be used to draft healthcare personnel in. Thank you for that. That's really fascinating. I did not know that. YouTube has taught me something today, as it often does. I'm an acute care coder for a large medical center. I'm the least liked one in here. On here, LOL, says musically inclined. Nah, it's not true musically inclined, because you are trying to get us paid in a currently broken system. One day your job will be obsolete and you'll find a new job for your skill set. But for now, we should embrace what you're trying to help us do, because someone's got to do it. And I appreciate you. I'd love to see Doc Vader discuss COVID-19, Callie. I know everybody says that, but Doc Vader's just not that popular right now. When I do Doc Vader videos, people are like, meh. I think he's past his prime, but at some point, I have the mask right there. I mean, he could talk hella shit about COVID-19. I mean, he'd just be like, I got a mask all the time, bitch. Where are we at now? Let's see. Hello from India, Gaurang Patel. Welcome. Welcome to the show. How's it going in India with COVID-19? I understand you guys have had a few cases, but it hasn't been as widespread. But teach me, inform me, educate me on that, because we want to know. Because India is near and dear to my heart, my parents being from Pune. But also it's a very densely populated large area that it has medical infrastructure, but it's not going to be able to handle a 15% ICU rate when people are infected. Ryan DeLolio, $10, thank you for Super Chat. Can you elaborate on why diabetes mellitus is cited as an underlying condition that increases severity of COVID-19? What's the primary concern and prognosis, worse than the lack of glycemic control? Great question. Answer is nobody knows. My speculation on diabetes is it comes with other comorbidities that modulate immune response. So insulin resistance and the metabolic syndrome around type 2 diabetes in particular can affect how people respond to viruses. One interesting anecdote, and this is pure bullshit anecdotal stuff. When I was doing keto for 8 months, in the middle of flu and cold season, I always get a cold or two every year. I got nothing. The minute I started introducing carbs back in the diet, and I tend to insulin resistant, I started getting sick more. So you do wonder, again, this is anecdote, don't even take any of that seriously. I'm just thinking out loud. But with diabetes, immune system is really different. And so, people get mucormycosis, even in the absence of terrible glycemic control. There's just a modulation that happens. So in the absence of more data or someone weighing in who knows more than me about that, that's the best I can do on that topic. But I tell you, we always say, oh, they're diabetic. Okay, they're at risk for these things. Always, 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 always. As a hospitalist, we just knew that's the comorbidity that's going to put you at more risk for infectious sepsis and those kind of outcomes. Let's see. As long as there's EHR, there'll be a need for coders unless we remove government from the equation. Learn to love us. Yeah, it's true, musically inclined. I'm actually inclined to try to remove government from the equation, but I don't think it's ever going to happen, so we got to compromise. Let's see. Happy Hospitalist Day, by the way. That's true, Diddy. It's a bullshit made-up holiday. Every day is Hospitalist Day, as far as I'm concerned. Your My Corona song is popular on quite a few prepping sites on YouTube. Kathy Burke, I love it. I'm glad to hear that. I'm glad it's getting the play that I think it should get. I really didn't want to do that song, but I got pressured actually by a guy who's a friend who's a high up in one of the major corporations in the country, and he's like, you got to do this. If you don't do this, I will lose all respect for you. So I got peer pressured by this guy who's the CMO of a major corporation and a smart guy, and I'm like, fuck it, I'm going to do it. And he was right. And you're right, Jacob. Epstein didn't kill himself. He was suicided by the Clintons. That's a running theme on this show. Would you rather healthcare be in the hands of a corporate state that has no democratic process, Mags? Okay, let's talk about that. What a great question. I consider the government and the corporate state to be the same thing. Government is simply a corporation that intends to keep itself in business and grow as much as it can, just like any other corporation. Our huge corporations without, and with regulation too, because regulation begets untoward consequences, have sprung up a system that is basically an oligopoly. It's a crony capitalism. It's not real capitalism. There's not real competition in healthcare. And the government contributes to this with good intending regulations that end up codifying what is effectively a Soviet-level Politburo. So Medicare sets prices. That's uncompetent. It's against competition, not free market at all. And businesses, big, large conglomerates like United Health, who I fucking hate, then take advantage of those regulations to gouge in a non-transparent way patients and employers and other things like that. So between the corporate takeover of medicine and the government takeover of medicine, we are fucked. So how do we fix that? Who should take over medicine? Us! Patients and caregivers. Like it used to be, right? So you have a revolution, direct primary care, where primary care docs are like, fuck United Health in every goddamn orifice that it has. We're gonna step off that grid and we're gonna start our own thing where we directly contract with patients. And we do everything we can to keep them out of trouble. And then others are starting to agitate to say, what if we had catastrophic insurance? that's real insurance that then covers you when you get really sick, and then everything else is competed, and the government can then step in and subsidize people who truly can't afford it. Or you can rely on charities, which I don't believe in. I'm not that much of a libertarian. So that all being said, it is a combination of pulling back certain regulations, allowing competition, government helping people who fall through the cracks so no one goes medically bankrupt, price transparency, which we don't currently have, taking the third-party administrators out of the equation, TPAs, and at least in their current incarnation, pharmacy benefit managers, people that are basically just middlemen, insurance companies in the classic sense for primary care. Why do you need an insurance company doing primary care? It doesn't make a lot of sense, right? So you're right, I wouldn't trust unmitigated corporate America to administer healthcare if they're under the same incentives they are now. You have to change the motherfucking incentives. Period. Are your songs on this channel? Yes, Loving Mom for Kids, they are. There's a playlist on my main page, YouTube page, that's called Music Videos. You'll see all the songs. The current system has all the hospitals merging together to pressure insurance companies, then raise their rates while cutting their staffing and make everything worse. That's right, Jeff Lum. It's a motherfucking money game. That's what this current system is. It's time we stepped off the treadmill, man. It's time we just said, you know what, let's stop playing these games. I like medical groups. I think they actually do really good, because when you merge a bunch of specialties together and you have physician leadership or nurse leadership, clinician leadership, you can actually really do good for patients if skin's in the game. So what if we were directly contracting with patients as a physician group, and the groups competed based on quality, cost, service, and outcomes? Holy shit. And that poorer patients who can't afford that shit or aren't employed, right? And employers can pay for this. If they aren't employed, then the government can subsidize, give them an account where they can spend that money on their primary care. In fact, they're required to, or they lose it. Something like that. That holds patients accountable too, because when patients fuck up and decide, I'm just gonna eat shit and treat myself like crap, they need to be held accountable for the costs that they're generating from that as well. Now, sometimes, again, it's tough to assign blame there. You grow up in a food desert, and culturally it's like all you can eat is garbage. Well, what are you going to do? You got to fix that too, which means you have to address social determinants of health. And that's a broader discussion in this country. It can't fall on the lap of healthcare professionals. It has to fall on the lap of society. What do we do with our social determinants that are fucked up? Is it a charity thing? Is it companies that compete to help those people? Is it government? I don't know the answer, but it ain't healthcare, motherfuckers. You want it to be 50, 60% of GDP? It's already 50% if you count people who are giving care at free for home, if you count about Social Security premiums that are actually used for health care, if you talk about the government tax subsidies for self-funded employers to actually provide insurance for employees, it's about 50% of our GDP, right, goes to healthcare. That's sick. We get the worst outcomes in the developed world. That's sick. It's a sickness. The system is sick. And I was complicit in it for far too long. I'm no longer going to be complicit in it. I'm going to call it what it is. It's fucked up and sick. Zeitgeist X, break up America. I'm kind of down with that. I like the idea of like a West Coast and East Coast, the South, the dirty South as a country. It's kind of dope. I guess if we fought a civil war over that shit, it's probably not a good idea. Let's see. Interesting. What about specialists? Great question, Mags. So specialists, right? There are increasing groups in surgery, for example, who are offering cash pay prices. You can still accept the catastrophic insurance. You can still band into multi-specialty groups, contract directly with patients, and be paid a salary with a bonus when the group saves patients money. I mean, what a great way to do it, right? Then everyone's skin is in the game. We're not doing unnecessary tests, but we're not withholding tests either. There are ways to do this. There are very American ways to do this that are egalitarian, that take care of our most vulnerable, that also are sustainable for doctors and nurses and healthcare professionals, and are uniquely American. Why do we need a European model? Fuck the Europeans. They're great people. If you go there, you're like, God, these people know how to live, man. They are doing it right. But we can do it even better. We're fucking America. I believe in American exceptionalism to the extent that I think we still are the beacon on the hill that can actually do something unique, learning from what the Europeans have done. Now, one thing Europeans have on us is they know the importance of food, of social connection, of social services. They know the importance of social determinants of health. I mean, this is who they are as a people. They've had a lot more practice doing this than us, and I tip my hat to them. And every time I visit there, I'm just taken by that. Andrew Dunbar, did Zeitgeist X just come up with the idea of states? Break up the U.S.? How about states? You know what? Sometimes you got to come up with the Constitution from first principles. You just do. That's funny. But the Z-Dog, American exceptionalism equals our current broken system. You're absolutely right, Zeitgeist. So when I say I still believe a little bit in American exceptionalism, only a little bit, in that narrow window, I think we can do something in healthcare that's unique. But I think otherwise, we're exceptionally bad at healthcare. But we are exceptionally good at innovation. So again, I'm a believer in this country, but I'm not, some kind of weird xenophobic right-wing loony. I just believe in this country to do great things. I do. Randy, for $5 for the new studio. Thank you. Not a healthcare professional, but love your videos and learn a ton. Also want to support the tribe. I love that so much, Randy. Thank you. Thank you for that. I'm going to keep going because there's 200 people here and I'm having fun having this conversation. What time is it? It's 5:06. Okay. I got to keep an eye on the clock. Meg Kumigod. Z-Dog, what do you think about patients who received a $3,000 bill after getting tested for corona? Yeah, welcome to the U.S. That's bullshit. Surprise medical bills are something Marty McCary and I have talked about. He's the Hopkins surgical professor. We've done shows on it. Check it out. This is a passion of mine. No American, there should be price transparency in healthcare, period. There's no incentive to do it, just like there's no incentive to deliver quality care. Do you get paid for better care? No. You get paid the same. It's because Medicare set the insurance model, which we're going to talk about that historian about on the show. Stay tuned. Oh, it's going to be awesome. You guys are going to learn about the roots of our dysfunction and how we can make it better, because until we understand why our system is the way it is, it started with the AMA as a big lobbying group in the 20s and 30s, refusing to let physicians band together to create their own insurance products. It wasn't really insurance. It was like a physician cooperative. Those were very popular in the early days, and they worked very well. So we're going to talk about that. It's going to be a great conversation. You guys will learn a lot like I did. William Schaefer, what do you think about expanding? Oh, wait, did I finish answering the question? What was the question? Yeah, so no, we need price transparency and no surprise bills. And whether that's, I'm always suspicious of legislation, but whether that's legislation or whether that's incentivizing clinical enterprises to be competitive in their pricing and transparent in their pricing and their quality, I think it's more the latter than regulation. It's actually removing regulation so they can compete. Understaffing in lieu of maximum profits is a huge problem. That's right, Kathy Burke, because why? People are only as good as their incentives. If they can squeeze more out of nurses and doctors and pay them less, they're going to do that because they're motivated by profit and keeping the lights on. Churning more patients. We got to change the incentives for hospitals. Hospitals should be cost centers. It should be a problem if you end up in the hospital, not a profit center. So there's a lot we can do. Brandon Getter, do you support drug legalization? 1,000%. Yes, I'm looking you in the eye, Brandon. The fact that we spend resources and time criminalizing a choice, potentially a bad choice that people make to use drugs, is insane. The fact that psychedelic medications, they are medicines, are illegal, is insane. The fact that we criminalize marijuana anywhere is insane. Do I think marijuana is a great thing to do every day? No. I think people who get stoned every day have other problems they need to deal with. Do I think drugs are good? I don't think cocaine is good. I don't think heroin's good. I don't think opioids are good. I don't think amphetamines are good, right? So no, but I think they should be legal and let people make the decisions because they're doing it anyways. And all we're doing is drawing resources away and stigmatizing and criminalizing a group of people. It's dumb. It's dumb. Don't do it. What do I think about New Zealand's system? So I've heard good things for lost comments, and I've heard bad things, but I'd have to learn more to be able to comment properly. But that's a great question because New Zealand is held up as one of the examples of like American doctors often go there to practice because they find it to be better. At least friends that I have done that. William Schaefer, have you almost answered my question? Okay, so William, what was your question again that I almost answered? Hold on. What do you think about expanding collaboration between docs and medics and getting paramedicine to go nationwide? So William, I have been a big advocate of collaboration between pre-emergency care, paramedicine, community paramedicine, and clinicians. This system should be integrated from pre-hospital to LTAC, SNF, hospice. One integrated continuum where everyone's skin is in the game. We don't have that now. It's all siloed, again, because of the way our healthcare system sprung up. The fact that we are so siloed means that we can't collaborate, hold each other accountable, and communicate well, and we need to. Paramedics are the ones in the homes, on the streets, seeing the social determinants in action, understanding why this patient's bouncing back. Why shouldn't they be integrated with emergency care where we're trying to keep people out of the hospital and with every other type of care across the spectrum? They should, period, end of story, case closed. Melissa's using my special supporter emojis with Doc Vader. Have him on again. Oh, he's coming on again, Marty McCary, Callie. He's coming on again. Let's see, where are we at? I gotta scroll forward here. Lito Quarles, who is a physician. Love that you're on YouTube now too. I'm listening to you here with my governor and public health department live stream, a COVID-19 update on Facebook. In my case, I think MD stands for multitasking deviant. Girl, you know you are crazy awesome. Thanks for being a part of all this. Eric Turner, I work in the call center of a hospital, and it really is like patients are guests in a hotel instead of patients in a hospital. Exactly, because the hospital's incentivized, right? It's crazy. We got to make hospitals really uncomfortable. People shouldn't want to be there. We want to keep people out. It's a great place to get an infection. It's a great place to have a complication. I always tell my patients as a hospitalist, my goal is to get you out safely and keep you safe while you're here, because it is the most dangerous place on earth you are right now. You are in the most dangerous place on earth, a hospital, a U.S. hospital. Andrew Dunbar with another $5. Without price transparency, the America can't even have a reasonable discussion about healthcare reform. Before anything else, that is needed. Yes, I agree. Nobody knows what anything costs in healthcare. If you ask a doctor who's performing a procedure, how much is that procedure going to cost? He or she can't tell you, because of all the obfuscation and the money games that go with these private non-disclosed contracts between big hospital systems and insurance groups that they can't disclose because blah, 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 and there's laws around that. Doctors can't own shares in a lot of stuff, and they can't act as business people because of regulation, and you don't want them to sometimes because there's conflict. So you got to actually set up the market so there's price transparency, that the patients have access to that information, can easily make decisions, or they have trusted authorities that help them make the decisions. But right now, there's just none of that shit. Now, hold on, guys. I'm getting texted. I want to make sure it's no emergency. I was just Tom Heineber sending me porn, actually sending me memes. Let's see. Oh, wow. Turns out Brett Weinstein is an anti-vaxxer. I don't believe vaccines are safe or that we fully understand the risks. Oh my God, and he's using my hashtag, Dr. Speak Up. Wow. He says, I'm a PhD, not an MD. You guys know Brett Weinstein? I believe vaccines are among the greatest human inventions discovered in multiple cultures and contributing massively to human well-being. My kids are vaccinated, but I don't believe vaccines are safe or that we fully understand the risks. That's crazy. It's paradoxical what he's saying. He may say they're not fully safe, because we know nothing is fully safe, and that we don't fully understand the risks. Well, we don't fully understand the risks of any medication, but we have enough of a handle that we think the risks are worth the benefits, right? I know, I'm surprised too. No privacy. I am absolutely surprised. I'm going to tell Tom I'm live casting on YouTube right now with this from you, LOL. Yeah, God, isn't he the brother of another Weinstein who's has a podcast and everything? Let's read this. Brian Parker, I love how informative and Raleigh you are. If I was in a position to give you some money, I would help you, but I've got some medical problems. No, don't give me money if you don't have it, Brian. Thank you for just being here. Yeah, Science and Stilettos, I'm shocked. Maybe someone sock puppeted his account. I don't know. I can't believe he's using my hashtag. That's not fair. He's an evolutionary biologist. That's right, Sarah Chalk. I heard a podcast, but I never finished it, with him and his brother talking about stuff. So the thing about him is he got in a lot of trouble, I think, from one of these PC universities, like morally outraged at him. I forget what it was. And so I support his position, because I'm like, dude, you should be able to speak. Brandon Getter, $1.99. Thank you, brother. You should go on Joe Rogan's show. You know what? Anytime Joe invites me, I'll be there. We're connected on Twitter and have exchanged messages before. I love Joe. I like the work he's doing. He's not always right, but you don't have to be always right. Dr. Suteki, have you seen Walmart clinics upfront prices? So full disclosure, I have worked with Walmart to help design their clinics in the sense that they consulted me a bit on what we learned from Turntable. And what I think they're doing has a lot of promise. I don't know how ultimately they'll execute it, but they are listening and they really want to do the right thing. And if they get it right, the rest of healthcare should be very scared because they are motivated to, they affect a lot of patients, like I forget, like 280 million Americans or no, 100 plus million Americans pass through a Walmart like every week or something. It's something ridiculous. So they have a lot of potential to do good. I like that it's interdisciplinary. I like that it's flat pricing. It's transparent. I like that they use a team. I like that they have optometry and pharmacy and lab and x-ray and medicine all there. I like that they use nurse practitioners and PAs and doctors together in a team. It's just a great model. So, hell yeah. Now, how do they treat their staff? I don't know yet. If they don't treat them well, then Andrew Dunbar, do a live stream with Brett Weinstein. He's nothing if not open to discussion and dialectic. Yeah, I think that's the sense I got with him. So I'm not too mad at him. I think he just needs to clarify his position. That's the other thing, guys. Just because someone has a dissenting opinion doesn't mean you vilify them. So Weinstein's a smart guy, so if he has a concern about vaccines, maybe we should address the concern and have a conversation instead of going, oh, fuck, he's an anti-vaxxer, fuck this guy, he's dead to me. So, you know, well, let me see what Tom's telling me here. Hang on. Oh, no, it's my wife. Yay, she's coming home. I'm texting and live casting. It's what I do, people. Come on, I have a life too. Okay, why can't, okay, maybe, I can't send you guys this. Anyways, why can't doctors do this, make a co-op? Exactly, because it's illegal, Mags. They're regulated as an insurance company then, which means they have to fulfill all kinds of crazy regulations, and it's impossible. And I know this because when we were running Turntable, the insurance commissioner in Nevada and I had to have a conversation about how do we structure this so that a flat fee doesn't count as insurance. It's a big deal, you guys. Like, these regulations are very harmful. They were done with good intent. Actually, they weren't. They were set up by the AMA lobbyists in the 20s. In those days, people don't understand this. Here's a little history lesson. The American Medical Association in the early part of the century, medicine was just emerging from its barbaric phase, more barbaric phase, where it was all about bloodletting. There's nothing we could do. Then you had the germ theory. Then things start to happen, antibiotics, these sort of things that really revolutionized modern medicine. Now doctors can start to do things. They differentiate themselves from the chiropractors and the homeopaths and the quacky quacks, and they form an organization, the American Medical Association, of which like 90+% of physicians were members in those days because it was a requirement pretty much for licensing and getting malpractice insurance in those early days. And the AMA was terrified of government takeover of medicine, and they were terrified of a corporate takeover of medicine, because in those days, corporations like today were emerging as these powerful entities. And there was a lot of suspicion in the public and among professional class that they were going to start to just basically corporatize medicine, which ultimately happened anyways. And so what happened then is the AMA lobbied and they prevented any doctor from forming a co-op. They would remove your privileges and then you couldn't practice. So they said, no one can do this. Doctors have to remain solo independent. Well, then it became clear that the government was going to intervene and, you know, socialize medicine, because that was a movement after FDR with Truman and others. And there was a fear among business community and medical community that this was a march towards socialism, because in those days, as you recall, it was the Cold War and everybody thought we were all going to be communists if we didn't put the brakes on that shit. So the AMA said, okay, let's do a deal here. The insurance industry is a private industry. Maybe we can endorse, the only insurance that we'll endorse is the insurance industry doing it, and it has to be regulated and fee for service. So only fee for service. You pay us for every widget we do. No capitation, no flat fees, no membership, no pay you to keep us healthy like the co-ops were doing. No skin in the game except for do as much to people as we can to make money. And they said that's what we want. And the insurance industry reluctantly went along because they didn't think it was very profitable in those days. But they said, well, if we don't do this, we got to kind of fall on our swords for this because otherwise the government's going to socialize medicine. And if medicine falls, insurance will fall next, life insurance and all these other things. And the next thing we know, we'll just be in a communist state. So that's how people felt in those days. So AMA and insurance companies complicitly worked together to regulate and make it impossible for doctors to band together and form cooperatives with their patients. It set things back because what ended up happening is then it became more and more codified over the years. And then insurance companies realized, well, like we suspected, it's really hard to make money doing this without controlling what the doctors are doing because the doctors are just doing all kinds of procedures. And there was data from those days where they did I think pathology stuff on appendixes and found that like the majority of the appendixes taken out weren't diseased. So people were just taking out appendixes because they could bill for it. And they probably weren't doing it intentionally. They were just like, oh, the guy has a little right lower quadrant pain. Let's just take his appendix out. And then when they actually looked at it, they were like, oh shit, these are healthy people. So incentives, dude, listen to me fucking carefully. We're only as good as our incentives. If you set the incentives up wrong, you're fucking everybody up. So AMA and the insurance companies set up the incentives wrong. So then what happened is the insurance companies pushed back and said, we got to now have prior authorizations and utilization review. We got to control these doctors because they're behaving badly. And the next thing you know, we're in corporate medicine where doctors are the slaves to the insurance companies. We still don't have a good incentive system. The employers now provide health insurance because of the subsidies by the federal government during the war era when wages were fixed. It's very complicated, but the bottom line is we're in a fuckstick mess. And it's AMA's fault. Now AMA is toothless, fangless, powerless, right? It's just like a third-rate lobbying group that doesn't even matter. But back then, it fucked us all. So there you have it. Join the AMA if you're an idiot. Mags, our fear of the unknown screwed us over. We sold out. Let's not do it again. I agree. Melissa Bradford, people are hoarding toilet paper, paper towels, water bottles, and hand sanitizer. They're rationing all of it. Yeah, this is what happens during these moral panics. This coronavirus thing is a moral panic. Medicine in the mind, that's exactly what Andrew Yang says. We need to alter our incentives. So Yang was right about that. I actually supported a lot of what Yang was doing in the healthcare space. The universal basic income thing I think is crazy, but the other stuff was actually not far off. There were a few other things he said in healthcare that I didn't fully agree with, but I think he was the most aligned of all the candidates on the Democratic side. On the Republican side, it's Trump, and you don't really know what's going on because he's just like, fuck it all. He doesn't have a plan, which I wish they would just come up with a really good plan and propose it so that we can debate it. Let's see. Why is universal basic income crazy? Mr. Vacuum Brain Bimbo. That's a subject of a different discussion. I understand why Yang thinks it's important to give $1,000 to everybody. He has arguments why that's not inflationary. I actually disagree with his premise that automation and AI is going to put us all out of jobs. I disagree. We've been saying that shit about AI about technology from time immemorial, and it's never happened. When a job is destroyed, new jobs are created. I disagree with his fundamental premise, and anyone working in artificial intelligence, actually working in it, like my neighbor who works for Google AI, will tell you we are so far from really good AI destroying jobs. We're so far from it, you don't even understand. So this idea of universal basic income because we're all slaves to the machines and we need to support society so we can, have stability and so on, and I know his arguments, it's just not even relevant yet. There is no main topic here, Yuri. We talk about all the things. All right, I think we did a thing here. We had a discussion with 200 people the whole time on YouTube, which I don't think has happened. Usually that happens on Facebook. I'm excited about YouTube. In fact, I have some calls tomorrow with YouTube that I'm very excited about. So you're going to see more of me on this platform. I want you to use the hashtag Doctors speak up, healthcare speaks up, patients speak up, parents speak up. If you care about vaccines and science, stop panicking about coronavirus, but do prepare, which we talked about earlier. One last comment, Jamie Todd, thank you for Doctors Speak Up and Vaccines work, because as a congenital rubella syndrome survivor, I don't want to see a whole new generation of survivors that come into this world that will suffer too. Jamie Todd, I'm so sorry you had to go through that. This is entirely preventable now, and we need to do that. Please become a supporter of the show on YouTube. Sign up for as little as $4.99 a month. Soon we'll be doing group chats via Fundo. That will be a chance for one-on-one video chats with me to grow this movement and get ideas and so on and have better engagement. And thank you guys for the incredible conversation here. You guys are smart and respectful of each other for the most part of what I see here, and awesome, awesome, awesome people. And you are the ones that are going to transform the system as a tribe together. All right, guys, I love you, and we out.